Hi, Betty. Welcome back. It's great to see you. So, first of all, I have good news for you. You've done the right thing in coming to see us. After reviewing your x rays and the series of exams we performed, I'm feeling very confident that what you have is treatable with chiropractic care. So, the good news is you're in the right place at the right time. Now that we've established that what you have is treatable with chiropractic, I want you to know a few things about it before we get started. As you may remember from the video we had you watch, chiropractic is not new, it is not experimental, and it's been a successful form of treatment for cases just like yours for over 100 years. In fact, the results of chiropractic have become so popular and so successful, it's now the second largest healing practice in the Western world. And what's most important for you to know is that a study by WebMD, following 2 million patients over a course of 4 years, demonstrated a 95% satisfaction rate with chiropractic. 95%. Now let me tell you, in the medical world of healthcare, it's impossible to find a better record or success rate than this. So you can feel very confident that you've come to the right place to find the solution to your healthcare journey. One more very important thing that you need to know about chiropractic and your choice in healthcare is that chiropractic is natural. In today's day and age, this is becoming increasingly more important. Because let's face it, we're all becoming way too drug dependent. Your body's been made with this amazing capacity to heal itself that far exceeds past anything that man could create, like a drug. Your body's better than a drug, and we need to rely on it first. In fact, have you ever thought about how your body heals itself from something as simple as, say, like a cut to the finger? Well, it repairs the tissue, it stops the bleeding, and within a short amount of time, you can barely tell an injury has occurred there in the first place. And it's able to do this through the control of a system which we call the central nervous system. This system knows better than you do what it needs to make the body healthy. And when we remove nerve interference, the body can better diagnose and properly heal itself through the use of this nervous system. That's why it's so important that your first choice on your healthcare journey be one that's natural, and not one that's heavily reliant on drug therapies with their harmful side effects and risk for addiction. That's not to say that drugs don't have their place, because of course they do, but they should be used as a last resort and not as a first. Now, let's talk about what brought you in here. Why do you feel the way that you feel, and why are you in the pain that you're in? Well, I'm here to tell you that your issue didn't begin yesterday, and it didn't begin the first day you were feeling pain. In fact, pain is one of the last things to come up when we're having these issues that we're having. Your issue's been building up over a long period of time and is the accumulation of all the events in your life. In fact, your issue began with the trauma of childbirth, and anyone that's seen a child being born can attest to the traumas that occur to the head, neck, and spine as we all go through this process. And it doesn't stop there. Think about all the hundreds of falls, spills, and injuries you've taken through your childhood and into your teenage years. You've needed this care as you've been growing up. It's amazing that any of us live past the age of 5 with all the hits and injuries our bodies take. If you would have had this care as you've been growing up, it would have saved you from a lot of the wear and tear you're experiencing now. Now, the reason I'm telling you this is because if you have kids, or if you're planning on having children, they're probably going to live to be 100 years old. And we want them to be as mobile as possible throughout those 100 years, right? Awesome. Let's take some time to talk about your lifestyle up until this point, though. Betty, it's impossible to count the number of improper lifts and physical traumas that have occurred to your body over the years. That's why we say it isn't just one event. You have wear and tear already. But keep in mind, this is with no prevention, no treatment, no care, and no effort whatsoever to offset any of these issues from occurring in the first place. As an example, let's turn towards the dentist. Imagine you never went to the dentist, or brushed your teeth, nothing, from the moment you were born to where you are now. Think about what kind of condition your teeth would be in. It'd be amazing to think that we'd have any teeth left in our mouth at all, am I right? The same thing's been going on with your spine. You have a lot of untreated nerve and tissue damage that's been allowed to be built up. So it's really fortunate that you're not in worse shape than you're in already. Now, it's taken some time to create this physical condition, so it's going to take some time to get out of it. As an example, we may put weight on over a 10-year period of time, and we'd all want it to be off in 10 days, am I right? But we simply know that's not how the body works. It takes time to create these physical conditions, so it's going to take time to get out of it. But we'll talk more about the timing of your treatment here in just a moment. Right now, I'd like to talk about where you are now. What are the results of our exam, and what are the results of all this untreated nerve and tissue damage that's been building up over this period of time? Well, you see, your nerves have been pushed and pulled out of alignment, causing a decrease in flexibility, an increase in irritation, and a swelling and a pinching of the nerves as they flow out from in between the individual segments of the spine, which we call vertebrae. Now, the medical term for this pinching of the nerves is called a subluxation. And if you look at this chart over here, you can see some of the things that occur with subluxations in different regions of the body. And I think you'll find this part fascinating. The reason so much of your overall health is affected by these subluxations is because nerves travel from the brain to communicate commands with different parts of the body and all the organs and tissues that are there. That's how your body knows how to properly function and work correctly. Does that make sense? Fantastic. Now, you came in here today with low back pain, but if you look at the chart, you can see some of the things that are associated with subluxations in that region of the body. It can lead to pain in the groin, pain down the legs, and even possible abdominal issues. This may sound like some of the problems you're having already, doesn't it? This is occurring because there's pinching on the nerves. And when we have nerve interference, it has the exact same type of effect that we experience today with our cell phones. When there's interference in a call, the call gets dropped, or it starts to break up and we lose communication. And what do? We move to the nearest location possible to try to restore the connection and get rid of the interference so that we can get the whole message across. The same thing's been going on with your central nervous system. Its ability to communicate with the body has been cut off, and the result is pain and disease. That's why we say subluxations cause more than just neck and back pain. They can result in other forms of disease as well. And when we as chiropractors remove this nerve interference, you're more than likely to experience better health in other areas of the body, not just getting rid of that back pain that you're having. Alright, so now I'd like to talk about the degeneration process of the spine. As you can see here, there are 4 stages in the degeneration process. Now, let's use an example that we all can understand and all know something about, such as cancer. When cancer is led to progress through the various stages, your overall symptoms and severity of the disease become worse over time, and it becomes more strenuous and it takes more treatment to get you back to where you were before. That's why it's so important that we begin treatment now, so we can stop the progression through the various stages and maintain what we have going on. So, currently I'd rate you at a stage 2 of the degeneration process. And let's take a look at your x-ray so you can understand a little bit more about what I'm saying. So, now that we've gone over those x-rays, I'm going to circle here on this chart the place that most exemplifies where you're at right now. So you can take it home to your friends, families, and husband and show them exactly what we've been talking about here today. Okay? Now, I think we've talked enough about the cause of your issues and what's been going on. I think we're ready to talk about what you came here for, the part you probably care most about, the solution. The solution for you is going to be a series of adjustments that I'll perform to put your spine back into its proper alignment so that you can get your whole health back. During these adjustments, there are a few things going on inside the body that I want you to be aware of, since they're not something that you can see. Number 1, I'm removing nerve interference so that your body has 100% capacity to heal itself from any current pain, sickness, or injury that you may have. Number 2, I'm removing nerve interference so your body has 100% capacity to prevent future pain and disease from occurring, so you don't get so much sickness to begin with. And number 3, I'm removing nerve interference so your body has 100% capacity to keep its future musculoskeletal performance, so that you don't get this wear and tear buildup and push down to this debilitating state, and you can keep your mobility for your whole life. Does all that make sense? Awesome. Now, the truth is, your spine has been misaligned for so long, it actually considers this misalignment to be normal. We're going to have to retrain it, and frankly, it's going to take time. But I'm going to adjust your spine and put it back into its proper alignment. And your spine is frankly going to readjust back to where it's used to being, kind of like 3 steps forward and 2 steps back. But I'll continue to adjust you and readjust you until we have everything working in its proper alignment and you have your whole health back. Now, again, this treatment takes time. That's why it's so important that you follow your prescribed adjustments down to a T. Don't miss any. It's the number of treatments and the timing of treatments that make chiropractic so effective. Can you see why that's important? Awesome. Now, a moment ago I said that it's going to take a series of adjustments. Did you catch that? This is for the exact same reason an orthodontist doesn't reach into your mouth and rearrange all your teeth into their proper position on the first visit. They, like us, will tell you it's going to take a series of visits. And with enough time and enough treatment, eventually they'll get your teeth back into their right alignment. That's exactly what we'll be doing here. Alright? Now, I've broken your treatment up into 3 stages. The first stage is the most obvious stage, and the stage that you care most about probably. It's the pain relief stage. We want to get you out of pain. Now, every person responds a little differently to this phase, but for you I'm including treatments 3 times a week for the next 4 weeks. And we'll also be supplying some additional therapies to supplement your adjustments along the way. I'm feeling confident by the end of this phase, you'll be feeling good. You'll be out of pain. You'll be thinking to yourself, I'm all better. Problem solved. But Betty, let me tell you now that this isn't the case. At this point in your case, in your condition, it'll be so fragile and so unstable that pretty much any wrong twist, any wrong turn, things that you're used to doing can set you back to where you are now, or even possibly make things worse. And then we'd have to start the whole treatment over again. That's why it's so important that we move on to the second stage. The second stage is going to be the stabilization phase. We'll do a short progress exam to make sure that your case is ready to move on to this stage. And it's also at this time that if we need to cut down the number of treatments we're providing, we'll cut them down. Because I'm going to be the first one to tell you that we're doing too much and we can cut it down and drop it back a bit. Now, assuming you're ready to move on to the stabilization phase, I promise you it's going to be easier for you going forward. When we adjust you now, we're only going to need to see you for 2 times for the following 3 weeks. And after that, again, we'll do a short progress exam to make sure that your case is going exactly how we'd like. Assuming you're ready, you'll graduate on to the third stage. And let me tell you why this third stage is the most important. It's the wellness stage. Once your condition is stabilized, the one problem we have with cases just like yours is that we're not actually removing the cause of your problems. You're not going to stop doing those activities that cause the nerve interference to begin in the first place on your musculoskeletal system, and we don't expect you to. The difference though being is that I'm going to provide a series of adjustments to make sure that you maintain and can counteract this wear and tear from occurring in the first place. Just like when you brush your teeth, it'd be amazing if you only had to brush them one time, and then they would stay clean for the rest of your life. But we simply know that's not how the body works. Your body takes maintenance and repetition. So, I'll make suggestions for your wellness treatment when we get to that point. But for right now, I want you to know that our overall goal here is not just pain relief. Wellness is what you need, and it's what we can provide. But for us to get you there, I'm going to need a few things from you. I'm going to need to make sure that you attend all of your regularly scheduled visits. Don't miss any. Again, it's the number of treatments and the timing of those treatments that make chiropractic so successful and work just for you. Does that make sense? Awesome. Now, secondly, I need you to attend the special class that we have that is so essential to your health and well-being. And it happens to be over a topic that I know that you can really benefit from and will enjoy. It's called the How to Stay Young for Your First 100 Years class. And it's chock full of information that I know you've never heard before. Now, I've included times and tickets for Wednesday at 5 p.m. or Friday at 9 a.m. Which one can I put you down for? Awesome. I'm going to write that in here. So, now that we've gone over this, if you do miss any appointments, make sure that you make them up. Because again, it's timing and the frequency of treatments that make chiropractic so successful. Now, I'm going to get Stephanie in here, and she's going to go over any financial questions that you may have, as well as get you scheduled for your How to Stay Young class and get your schedule advancedly scheduled so that you don't have to think about it and we know exactly where we're going. Does that make sense? Great. I'm going to sign here indicating that I've made my best recommendations for you. I need you to sign as well so that you can make every effort to comply with our treatments. Awesome. I'm going to go grab Stephanie. She's going to go over all that information with you. Now that she's gone over all that, I'm feeling really confident that we can begin your treatment. Are you ready? Awesome. Let's go.